Dr. Ingo Schäfer studied veterinary medicine until 2016 and completed his doctoral thesis as well as his Master of Small Animal Science in 2019. Since 2021, he is a resident of the European College of Veterinary Clinical Pathology. And in 2018, he joined Laboclin, where he is working in the Department of Veterinary Clinical Pathology. And Dr. Schäfer, we are very much looking forward to hear your combination of the two announced talks.
Yeah, thank you, Dr. Gosse. I'm really happy to be invited, so thank you so much. I will try to share my screen here. Hopefully it will work. Are you able to see the presentation right now, Dr. Gosse? Does it work?
You are still in presenter mode, so you might want to switch on. You can just go to the top menu exactly, and there you can switch the screens. Yeah, now it's perfect.
Okay, perfect. So welcome all of you. I have to apologize for Dr. Müller not being here, but I will try to take her part. And first of all, I want to introduce the company to you. Laboclin is a commercial laboratory, and we are offering diagnostic tests on a fee-for-service basis to veterinarians, mainly in Europe. And our headquarters is in Germany, in Bad Kissingen in Bavaria. That's a quite small town. And we are covering almost all aspects of laboratory diagnostic, as for example, hematology, biochemistry, endocrine testing, genetic and molecular testing, pathology, cytology, and last but not least, testing for infectious diseases. And this is the topic I would like to present to you today. And we are not we are of course also interested in research, and I would like to show one project to you that we developed in the last months. It's a homepage called vbd.laboclin.com, and our aim was to provide relevant information about several vector-borne infectious diseases in dogs, cats, and horses, for owners as well as for veterinarians. So let's start. We have seen more travel activities in Europe in the last 10 to 20 years, and also the travel with pets increases. Additionally, we have more import of dogs and cats from abroad, especially since the COVID pandemic started. And there are also climatic changes in Europe, which lead to changes of vector habitats. For example, Dermacentor reticulatus as a tick is a very nice example, which is now spread over whole Germany, but wasn't about 40 to 50 years ago. And another point is the missing awareness of emerging diseases, even by veterinarians and also by the owners. So we decided to put some information together regarding seasonality of vector-borne infectious diseases, their regional distribution in Germany, and changes in frequency of positive test results over time. In most of the pathogens, we covered a time frame from 2007 to 2020. And we wanted, of course, as it is always good for a homepage, the graphs dominating over text. So let's have a look. That's the starting page here. And here you can choose the different pathogens. For example, you can see Anaplasma, Phagocytophilium, Ehrlichia, Borrelia, and Dirofilaria. Additionally, we have Babesia, Hepatozoon, Leishmania, and also the tick-borne encephalitis virus presented here. And what did we do? We put some general information there. For example, here for Anaplasma phagocytophilum, a short introduction, also mentioning the zoonotic potential, the vector, and also non-vectorial routes of transmission, as for example, via blood transfusion. We added diagnostic methods. So as you all know, you can test by direct detection methods, as for example, PCR or blood smear analysis, and indirect detection methods, as for example, the antibody ELISA or the immunofluorescence antibody testing. When we had a look at the results in our lab and divided our study population in different time frames, as you can see here in these tables. And please recognize that we have quite a high number of dogs here included, so over 110,000 dogs. And please also recognize the rising amount of dogs tested PCR positive and also tested positive by ELISA and IFAD here from 2013 to 2020. We established this also for cats and for horses. I want to show you the cat graph here because later on we will deal with feline vector-borne infections. And we were able to include 1,400 cats about, and that's a quite high number. If you look at other studies, numbers are often lower. And also here you can see this rising trend in the PCR testing as well as in the testing by indirect detection methods. Then very interesting, we had a clear seasonality in the Anaplasma data set. Please recognize the months here on the x-axis and the percentages of dogs tested positive on the y-axis. And this blue line represents the PCR testing and the red line, the antibody testing. And recognize these peaks, please, here in summer, so in June. And this is fitting very well with the vector activity of Ixodes ricinus ticks in Germany, because they also have their highest level of activity in Germany. And what's also interesting is if you look at the graph of the antibody, you can see that the peak here is about 1 month delayed to the peak in PCR testing, which fits very well with seroconversion of the pathogen. When we did distribution mapping, it's a little bit complicated to explain it in detail. It would take too much time, but you can see Germany here. And when we calculated a machine learning model and calculated the likelihood of positive PCR results, and the low likelihood is represented by these blue areas here, a moderate likelihood by the yellow, and a high likelihood by this orange color. And yeah, you can see that distribution in Germany is quite different. So there are differences which may also be explained by vector habitats, for example, or also climatic conditions. So what is the benefit of our homepage? We want to identify high-risk area, as it is already done in human medicine, for example, for tick-borne encephalitis virus, or also for borreliosis. And we want to inform the clients and veterinarian on special needs for preventive medicine. So ectoparasite control as one example. And we want to optimize differential diagnosis according to seasonality and also regionality. We want to support the veterinarians there in thinking about special vector-borne infections in their region. And also we included a high number of pathogens with zoonotic potential. So it's also a tool to analyze risk factors for humans, because many animals serve as pathogen reservoirs. So this may also be important. Okay, thank you for your time showing you the homepage. And now we will come to my special field of interest. And I think it's a very, very interesting field, because feline vector-borne infection, it's a very challenging diagnosis in most of the cases, because you have very unspecific clinical signs, and most often also unspecific results in hematology and biochemistry. And in cats, you have got limited knowledge about the pathogenesis, vectors, and also the transmission routes of many vector-borne pathogens. And I brought two cases with me today. I want to present you, also dealing with pathogens that you may find in South Korea. The first cat I would like to show you is Luna. It's a European short-haired cat, 6 years of age, female with outdoor access, and it was regularly vaccinated and dewormed. And it had a long history of gingivitis. It was tested positive for Kalizi virus. When the cat developed rhinitis, and they did an endoscopy, were suspicious of feline asthma, and they started an inhalation therapy with dexamethasone. And about 2 months after starting the dexamethasone therapy, the cat developed with ulcerative lesions. Please recognize them here and also here. And you can also see this here in the face of the cat. And uveitis anterior was diagnosed additionally. I have to say the picture is not the best, but you can see some pronounced blood vessels here and also some precipitates. And the vet called me because he did not know what to do with this cat. And yeah, the clinical signs, I think they are not so unspecific in this case. So I had a clear idea which direction we should go, and I recommended to do hematology. And as you can see here, we had mild leukocytosis with mild lymphocytosis and mild monocytosis. We had mild reticulocytosis, mild thrombocytopenia, and eosinopenia present. So yeah, you would say nothing special perhaps, but the high lymphocytic count is surprising, because you would have expected a stress response also due to the eosinopenia, and then you would have expected lymphopenia. So this is something which is quite interesting here in this cat. And we also did a biochemistry, and I think the most interesting finding is the mild hyperglobulinemia in this case, and also the decreased concentration in iron. And they also did a serum protein electrophoresis, and I give you a few seconds to have a look at it, and perhaps to draw your own conclusion, because it's a very typical electrophoresis for the disease the cat has. Okay, then let's go on. And I think you recognized these two peaks here I marked with the red circles. One is located in the alpha-2 globulin section, and one is located in the gamma globulin section. The peak in the gamma globulin section is polyclonal, whereas here you can discuss it a little bit. If you take this here into account, it may be monoclonal. If you take this into account, it's more polyclonal. But there's a very interesting study about serum protein electrophoresis in apparently healthy cats infected with Leishmania. And this was also my first thought, that this cat may have Leishmania due to the uveitis and the ulcerations because yeah, there are not so many differentials if you take these both together in consideration. So very interesting electrophoresis, and I told the vet to do an impression smear from these ulcerative lesions, and what you can see here, very interesting finding, all these organisms here are mastigotes of Leishmania infantum. So we already had the diagnosis with the cytology, and it's very impressive, I think. As a clinical pathologist, you get really excited if you see something like that. So I asked the vet, please go back to the owner and ask them about potential stays abroad, because till now, at least, Leishmania is not seen as endemic in Germany. And the cat was imported from Spain 3 years ago, so this also fits with our diagnosis. And the owner said that the cutaneous lesions were already present, but to a much lower extent at the beginning. And since the cortisone administration, it worsened. We did a feline travel profile testing, and as expected, we had a high antibody titer for Leishmania. We also found antibodies against rickettsia, and the Leishmania qPCR, so the quantitative PCR, it revealed a very high number of Leishmania per milliliter blood, so about 700. And the cat was also tested positive for Bartonella henselae in the EFOD, but PCR testing for Bartonella and rickettsia were negative. When we decided to test for FEFV and FIF, which was a good decision, because there are many papers, or not so many in cats, but at least a few, dealing with the fact that cats develop only clinical signs in case of Leishmania infections if there is an immunosuppression going on. So you have to look very carefully for potential underlying diseases there. And in this cat, it may be the FELV and FIF infection, which was triggered by the cortisone, which was applied by inhalation therapy due to the suspicion of feline asthma. And please also recognize this high serum amyloid A. As you all know, CRP, so the C-reactive protein, is a good marker, a good prognostic marker in dogs. But there's very limited knowledge about SAA in cats with Leishmania infection. So we had to decide with the vet what to do with the cat, and that's not so easy because there are not so many treatment recommendations for cats with feline leishmaniosis. There are very nice guidelines of the colleagues from the ABCD forum, so the advisory board on cat diseases. And we followed their guidelines, and we applied allopurinol to the cat twice daily orally. And then also alpha bisabolol, and that's something I want to discuss a little bit, because as you may know, it's chamomile, a plant, which is also presented here. And it's an extract with high purity, so you can recognize it here, about 99.5%. And it is thought to stimulate the Th1 dominated immune response, which may lead to the improvement of clinical signs and reduction of Leishmania in one study in dogs. And we tried it in this cat because the cat had ulcerative lesions, and it's very easy to treat them with this alpha bisabolol. You have only to put it on the wounds, and the cat tolerates this very well. And here you can see the cat 4 weeks after starting treatment. And please recognize that the lesions, they were almost gone. You can see, yeah, some left. And the cat is looking much more active. The owner is very happy. So we are still monitoring this cat very carefully because it's a quite actual case. It's now in the 6th week of allopurinol treatment, and it develops very good. The SAA decreased. It's almost in the normal range now, 6 weeks after starting treatment, which may also be a possible link of the SAA to the improvement of clinical signs. Yeah, but I would be very happy to discuss it with you later on, what you think about the alpha bisabolol and general about leishmaniasis in cats. But before we discuss it, I have a second case for you. Dobby. Dobby is a La Perm long-hair cat, male castrated 7 years, regularly vaccinated and dewormed with outdoor access. And the owner recognized tick attachment. But in this cat, there were no stays abroad from Germany, and no ectoparasite control was performed by the owners. The cat was presented to myself as an emergency case, working in the small animal clinic of the Freie Universität Berlin. And it showed inappetence and lethargy and high fever with almost 41 degrees Celsius. And we have collected this tick, which was classified as an Ixodes ricinus tick, yeah, from the cat. It's always a good idea to have a look at a blood smear in cats with fever. And please recognize these nice neutrophilic granulocytes here. And if you have a careful look, you may recognize this morulae. So these inclusion bodies, which are not normal to call it like this. You can also see it here in this neutrophil. And this is highly suspicious for an Anaplasma phagocytophilum infections. You do not have too many differentials. It may also be Ehrlichia ewingii, but Ehrlichia ewingii is not endemic in Germany. It's located, or it's linked to the United States. So this seems to be uncommon. And the conclusion was that Anaplasma phagocytophilum was my first differential. When looking at the blood work, there was moderate thrombocytopenia, and this convinced me even more that it may be Anaplasma phagocytophilum, and additionally mild leukopenia and lymphopenia. And in the biochemistry, we saw hyperproteinemia with hyperglobulinemia. The X-ray and the ultrasonography of the abdomen showed a mild homogeneous splenomegaly. So what did we do? We tested for Anaplasma phagocytophilum by PCR, and it came back positive. And we also performed an IFAD, an antibody test, which was also positive. But all the other results here are negative, for example, for thrombocyte-bound antibodies or hemotropic mycoplasma or Bartonella. And also FELV and FIV was tested negative. So our diagnosis was an infection with Anaplasma phagocytophilum, and hopefully I could demonstrate to you what is needed for this infection. You need the vector, and we collected this tick. You need the pathogen, and we demonstrated it in this neutrophilic granulocytes. And you need a suitable host, and this was Dobby, so our cat. What did we do? We treated with doxycycline. Please be aware that this is not so easy in cats because you have to take care because of esophageal strictures. So you should apply this only with food. And we also applied omeprazole and metamizole. And the cat developed very well. And 21 days after starting treatment, the cat was fine, and all hematological and biochemical abnormalities were gone, and PCR testing was negative, but antibody testing was still positive, which is not surprising because these titers can persist for months and years. And please recognize that anaplasmosis may also affect humans. There's a nice paper of a case report in a human from Austria. And they also state that in human medicine, it may be underdiagnosed because many people in human medicine do not have it in mind as a potential differential diagnosis. So only to show you a short overview over different pathogens of the cat, let's start with bacterial pathogens. And I do not want to go through this table in detail with you, but I want you to recognize how many of these bacterial pathogens do have zoonotic potential. All these which are marked with this red cross. And also protozoal pathogens. We discussed about Leishmania. The others here in cats, as babesiosis, hepatozoonosis, or pseudoxoonosis, they do not have zoonotic potential, but especially pseudoxone is a very interesting pathogen, but I do not want to deal with this today because we are running a little bit out of time. And then some others, as for example, Dirofilaria or Thalassiosis, all with zoonotic potential. And please recognize this nice Dirofilaria here in this blood smear. Okay, so thank you so much. Hopefully you enjoyed this short trip into the field of feline vector-borne infections and vector-borne infections in general. And I would be very happy to answer your questions.